KFE, our home planet. And we will continue in, because, we said this is National Caregivers Day, the day that we pay a lot more homage to those people that do that kind of work for the rest of us. But as I was talking with Cynthia, Cynthia, is still with us?
I'm still here.
All right. And we have someone new, Stephen Wanamaker, also, who will give us a little time to. But, it's more than just Caregivers Day. It's the day that you really need to start thinking about calling either Care Assist or some other company that, start anywhere. Just make sure Care Assist is among them that you call. And do your, do your homework now. So when the time comes that you need somebody, you know exactly who to call. So we have already introduced Cynthia, and we got we started talking about the services that Care Assist does, and I think we just barely scratched the surface. But I also want to introduce also Stephen Wanamaker, and perhaps we should have Cynthia introduce him to start with, and then let Stephen take over.
Oh, I would be happy to do that. So I know Steve Wanamaker on a professional and personal basis, and he is one of my go-to colleagues when it comes to people who can no longer remain at home safely, even with excellent care in place. Sometimes people need to go to an assisted living or memory care environment. And when that happens, I turn to Steve and Oasis Senior Advisors, and he handles that transition. And I'll let Steve tell you more about how that works.
Okay.
Great. Hey, thanks, Cynthia. Thanks, Jay. I'm excited to be here today. And as Cynthia mentioned, we've been working together for a few years, and our services are very complementary of each other. Cynthia helps folks that want to stay at home, and of course, most seniors do want to stay at home, and that of course is the goal, I think, for most folks. But as Cynthia said, there are sometimes circumstances where that older adult either can't remain at home due to care considerations, or sometimes it's based on budget, because with home care, as you increase the number of hours, that increases the cost. And there is kind of if you looked at a graph, there's an intersection where it's going to be less expensive to actually reside in a community than it would be to stay at home with caregiving. So, when that happens, my company and I, Oasis Senior Advisors, we work with families to help them really zero in and focus in on the best communities based on the care needs of that particular client, their budget, their location preferences, and then other things like the amenities and services that are offered by that community, the social and activity needs of that particular client, and really trying to really reduce the amount of time that it takes that family to find that perfect choice based on their criteria. So that's really what I do, Jay.
And how do people get a hold of you?
Well, they can find me on the web, oasisssenioradvisors.com. And if you add a slash and then coastal-OC at the end, that goes directly to me. So I am part of a national franchise, Oasis Senior Advisors, and I'm the franchise owner for what we call Coastal Orange County. You can also reach me on the phone. My number is 949-535-1599.
Thank you. We'll do that. But yeah, you had mentioned, usually I think of, okay, so if somebody has in-home care, they're going to want that, first of all. Most people are going to want to stay in their home. Most people are going to want to be more independent, or feel like they're more independent than they would be, say, in a, quote, nursing home. I want to get to that phrase also in a second here. But so they want to do that. So then in my mind, I think, okay, we've graduated. Now we need actual medical care. And when there's medical care, if it's a small degree, it can still be done at the home, but there's usually going to be a spot where there's a transition to what we speak of as a nursing home, or, you know, a specific care type home, and which we think of as long-term health care. And, you know, in the United States of America, 70% or over 70% of the people think that Medicare or whatever kind of health insurance they have right now, it will cover long-term care, and that's just not true. But yeah, if you could, Steve, we get into a little of that crossover thing where people may need some real medical help at home. And then I want to address the word nursing home because, you know, in my mind, it's a pretty terrible thing. But in your mind, it's not necessarily that way, because you see what a lot of these different communities look like, and they probably should not be pigeonholed into something that's called a nursing home.
Yeah, no question. You know, like you mentioned, that term nursing home, I think, is kind of a catch-all for a lot of folks when they think of a senior living situation or a senior living community. And like you said, nursing homes are primarily medical facilities. They do take care of seniors that need long-term care that may not actually have the need for medical care, but you know, those folks are typically low income that need to be taken care of through Medi-Cal, through the state, right? You know, what I'm really working with are what are categorized as assisted living communities, also what we call here in California a board and care home, which is also called a residential care facility for the elderly, which I'll get into that in a little bit, or a standalone memory care community. All of these communities are not medical facilities. They are, by license, custodial care communities that take care of residents and their activities of daily living, not any kind of medical care. And like you said, some of those communities, you can get some medical care that would be provided by a home health agency.
Right. Okay. Yeah. That's be like an add-on to, yeah.
Exactly. But like you said, Medicare does not cover the cost for any of those communities, assisted living, memory care, or residential care homes. You would need to have a separate long-term care policy to cover those costs, or there are some government programs for veterans that can step in and pay for part of that cost as well as in-home care.
Right. And a lot of it, I'm sure, is paid for by the seniors selling their last home and having a lot of equity they can kind of put into the next place, or from investments and pensions and, you know, whatever else. Yeah. All of us, see, this is an old person, and, you know, so a lot of us think as being real poor. And I have been, but, you know, so as we get older like that, there are a lot of places that would be very, very good for us that may not be home. Like I have a wife that's taking care of me after I've just had 2 surgeries. She needs, you know, she probably should get a day off or 2 from a company like Cynthia's here. But, you know, and then as it goes up, it becomes expensive to have in-home care. And then, as you said, it seems like it's more expensive to be in a home. What would you, I don't want to call them nursing homes. From right now, I'm not going to call them nursing homes. What are we going to call them, Stephen?
I think we should just stick with assisted living communities.
Okay. I think that's great. Assisted living communities. They can include, you know, your rent. It can include different levels of service. And it can include food also. So there's going to be a place where overall it's probably less expensive than in-home care.
Yeah.
And that's not just having a little room with a nurse come in that takes the, you know, some of these are like real houses, real, I have a cousin that moved just the last couple of days into an assisted living facility in Laverne, I believe.
Okay.
And basically, he lives in a duplex, which has
No,
one
nice.
wall that connects just the garages. And other than that, he can call for whatever he wants. He can go to the dining room, but doesn't have to. So you're kind of set from being able to be, ambulatory, make your own food and things like that, all the way to the end.
Right. Yeah, I'd like to maybe take a couple of minutes and describe the different types of communities that are available.
I think that would be great.
So, by using kind of a general term like assisted living community, we're really covering several different types. The first would be a community that, it really feels more like a resort than any kind of a facility. When I use the word facility, I really think of a medical facility, right? With linoleum floors and you're sharing a room with another person. You're both in hospital beds, with a curtain in between. That's what I think of when I think more of a nursing home. An assisted living community, it feels more like a resort that's very well appointed, that has very nice decorations, and there are, of course, different levels depending on your budget, for instance, as to how extravagant and luxurious this community would be. But in any case, you're going to have an apartment. Those apartments can be anywhere, generally from studio apartments up through 2-bedroom apartments. There are communities also that have shared rooms or companion rooms, in case your budget is such that you need to cut costs and share a room with another person. And then some people they want to be with other people because they're very social.
That's so true. Yeah.
Right. So those communities, they're going to have between, let's say, 50 and 250 residents in general. You are going to have a dining room where you're going to have all of your meals served to you. You can take your meals in your room if you'd like. Most communities are going to charge a nominal fee to bring a meal to your room unless you're sick. And then they're going to have usually a number of activities, between 7 and 10 activities a day that you have access to, whether it be something as simple as bingo, or it could be a movie in their movie theater. It could be, at least pre-COVID and hopefully post-COVID, going to museums or plays and getting out using their provided transportation.
Some of those things that senior citizen centers do, as far as trips and a trip to the casino or weekends to Las Vegas or Grand Canyon or that kind of thing. But they're also probably as available, if not more available, if you're in one of these assisted living resorts.
Yes, of course. Yeah, and some people they describe them as cruise ships on land. Right?
Wow.
You have all different appointments of a cruise ship, but you're not actually cruising on the ocean. So those communities are in and around all of Southern California, of course. The next type of community is more of a specialized community that I'll just call standalone memory care. And these are communities that specialize in taking care of seniors that have a cognitive impairment, anywhere from possibly mild cognitive impairment all the way up through advanced Alzheimer's or dementia. And those are larger communities. People have either companion apartments or private apartments, and they also have their meals in dining rooms. They also have activities. Those activities are typically going to be really focused on folks that have memory impairment or cognitive impairment. So you're typically not going to see a lot of trips out to plays and museums. It's really going to be more in the community, but a lot of times they may go even just for walks on the beach or go down to the harbor to get those folks out as well. And then the third type of community is what the state calls a residential care facility for the elderly, an RCFE, but we just kind of casually call them board and cares here.
Are those what some people refer to as six packs?
Yep, they call them six packs. Sometimes you'll hear people call them group homes. These are single family homes that are located in neighborhoods throughout California. And in terms of, let's say, Orange County, I know there's at least 1,000 board and care homes just in Orange County. And, this is more of a home atmosphere, right? And some people, they just prefer that home atmosphere versus, being in a larger community. It's just more comforting to them.
One thing you mentioned earlier about, sometimes people would rather share a room. Well, sometimes it will go to that degree, but a lot of times you just want camaraderie. And, if you want your own private room, but want that kind of camaraderie, it seems to be there anyway, because meals can be served, in one dining room where you meet people or you play cards or have other activities.
Yes.
In those, yeah. So.
Yeah. And these smaller homes, these communities, the six packs, the board and cares, one of the advantages is that you have a very good resident to caregiver ratio. So typically you're going to have 6 residents, and there's typically during the day going to be 2 caregivers there. Sometimes there's 3. So you've got a better ratio there than you typically would have in an assisted living community. Assisted living, it might be 15 to 1 versus 3 to 1.
Wow. Yeah.
And then one of the key aspects of these board and care homes is, does the resident need help or care at night? Because while all licensed board and care communities have caregivers there at night, and they're required to by law, there are some board and cares that pay a caregiver sometimes to be awake all night to care for residents' needs. Others pay those caregivers to be there, but they're sleeping at night. And as you can imagine, there's generally a difference in cost between board and cares that have awake staff and board and cares that do not have awake staff. You're typically not going to have near the amount of activities available to you in these board and care homes as you would in assisted living community. But in most cases, those residents, they're not looking for that. They possibly just don't have that interest. Maybe they'd like to, have a quieter existence. And sometimes they possibly have advanced in their cognitive decline, where these activities are just not going to be used by them very much. One of the big advantages to the board and care homes is cost. Generally over assisted living communities, most of the board and cares, it's just going to be an all-inclusive fee that includes your rent, all of your care, your medication management, your laundry, your food, everything. Most assisted living communities are going to charge you rent, and then you'll have levels of care that you'll pay for based on what you need. The food and housekeeping is typically included. Laundry services typically would be an extra cost unless you're talking about memory care.
Right. Well, these are all these little add-ons are extra cost, but if you're doing your own laundry out in the real world, that's an extra cost too.
Sure it is. Yeah.
So it all adds up. And how does it balance out? Well, if somebody needs health care, it's going to balance out pretty easily, because without it, you're not going to be as healthy. You're not going to enjoy your life as much. So I think the big thing is, in each person and perhaps each family is a little different as to what level they'll go from, say, a care assist into using your services and making that kind of a move. But I think it's inevitable in most, and we are growing older. You don't look like you are. You look exactly the way you looked the first time I saw you, which was about 25 minutes ago.
Yeah.
So you haven't aged at all. But me, I think so. But it's so important for people to know all the information you just gave, and there's probably a lot more to it even than that. And, because people have in their mind nursing home, I think of something more like a hospital with that kind of that kind of a vibe.
Right.
Okay, we're going to go take a walk around the hall and back today. And what it's really like. I know my cousin, who I mentioned earlier in the hour, have been really looking forward to making this move. They love the home they're in, but you know what? Even old people like myself, we like change every now and then.
Yeah.
I mean, my wife still has her bell bottoms from when she was in her 20s, so she's not into change that much. But I think people, no matter how much they like their home, sometimes a change is always good. It's like a kick in the you-know-what.
Yeah. One thing you said earlier, Jay, and I want to emphasize this, and you talked about independence, right? And folks that live at home feel like they're more independent than they feel like they would be if they were living in a community. And that
because
really,
they help pay for that home. They were there their whole life for many years.
Right. But just because you're living in a assisted living community doesn't mean you've lost your independence. You can come and go as you please. If you want to go out to lunch with your daughter, you can do that. If you want to go spend the weekend with your son, you can do that. If you want to go travel, you can do those things. Now, COVID has certainly
for everyone
changed a lot of that, because the ultimate mission is to protect the health and well-being of the residents. So there are some restrictions there with COVID. But in general, you're just as independent as you would be living at home. Now, there is a caveat to that, of course. If you are in a situation where you are cognitively impaired, you have dementia, and if you're in a memory care unit, right, either that standalone memory care building or a memory care unit inside of assisted living, then those are kind of wings of the building that restrict the ingress and egress for the safety of the residents, because the residents have a history of wandering, and we want to make sure that those folks are safe. But as a person that does not have dementia, you're living in assisted living, you're just as independent as you would have been. You can cook your own meals if you want. If you want to in your apartment, assuming your apartment's acquainted
has a kitchen, and yeah.
Exactly. But that's one of the things I hear a lot from seniors, is that they're afraid they're going to lose their independence, and that really doesn't have to be the case at all.
No. And there has to be, I can say this again because I'm old, and there's a time when you have to lose some independence. There's a time when you get too old to do something. And I don't feel I've hit that yet, but I know probably I have somewhere down the line. I must be working less hours than I was before. There's things I just am not doing that I did 50 years ago, before you were even born. So there will be a time that somebody has to take over some of the independence, but that doesn't mean, it doesn't mean you've lost your right to make decisions. It doesn't mean you've lost your right to make this, to decide what you're doing today and things like that. It just means that somebody else is taking charge of one or two items that must be done for you.
Well, my dad's 81, and I keep telling him to not get on the stepladder and put up the Christmas lights.
Yeah, and that, where that goes.
Yeah.
Yeah, but to him, and I can tell you, he's even older than I am, so congratulations to him and to you. I want to do the same kind of thing. I want to get on the roof and see where it's leaking, or if it isn't, or what's what. And, my mind tells me I'm just the same as when I was 24. And, I don't know if I have enough booze in the house, but I can trick myself to looking at a 24-year-old if I had to. You just don't realize these things. You don't realize that, I was supposed to be an old man by now. Why don't I feel like it? Well, you know what? There's probably a lot of things I don't realize, that I am older than I was. And those things are going to come on you little by little by little. And then, God forbid, if you fall off that ladder, like I might, uh, then you've got assisted living right away.
Yeah, or worse.
Yes.
One
Very.
other thing I want to mention, Jay, is, in terms of going out and finding these communities, and of course that's what I do, there really is no reason for you to try to have to go it alone, because my service is actually free to the family. It's free to the senior. The way that I get paid is very similar to the real estate model, where
Right.
if that senior moves into a community that I show them, then that community actually pays me a referral fee. So if
Right.
to paying or hiring a realtor to go find you a house that you want to buy, well, the way that realtor gets paid is the seller pays their commission. So just want to be clear on kind of how my
Right.
business works. And again, there's no reason to go it alone, because you don't have to pay me a dime to help you find the right community.
No, and I'm going to. I mean, that's kind of the same way us in the lending industry are paid too. We're paid by the banks for bringing them the business, and it saves them money from having to go and doing their own marketing. So the client is never charged more than if they had walked right in the front door. So it's pretty normal across the board that way. And then I was going to bring something else, but Sean, do we need? Is it break? Do we need to take a break? Well, that means okay. So anybody need to take a break out there? And please,
I'm
we
okay.
don't have you behind bars. You don't have to wait all the way till 5 o'clock. I wish you would, but you don't have to. But if we don't have any sponsors or people like that want to say hello, not even Ron Siegel would pay for a commercial during my show. Sean, what's the story? Anyway, that's true. I'm only kidding. So in any case, I'm happy both of you can stay on for a little bit. We can bring Cynthia back into the conversation also. But I think it was considering whether we needed the break or not, I was stepping on Stephen's toes because he was starting to bring something out.
Hey, it's your show, Jay. So.
Oh, no, not during this part of it. No. Was there something else you were bringing up, I believe, that...
No, I just, I wanted to be clear on how the structure of the business works. And, something that you said earlier is, how to pay for this, using private money. As a reverse mortgage specialist, of course, there are situations where the husband might stay in the house and the wife might go to assisted living, or vice versa, where a reverse mortgage could help pay for this type of service. So
absolutely. And, like I said, I try to make this part of the show about you guys, not about me, but I really don't know why everyone 62 or older doesn't have a reverse mortgage, because it doesn't mean you're taking money out of your home. It just means you're making it available for the time you may want to use it. And a lot of people have really used it to preserve income, preserve their legacy, and preserve their portfolios, which, my portfolio is full of a lot of pictures, but other people's do have investments in them. And these are the kind of things that will help pay for the nursing home later in life. Even if both husband and wife leave the home and no longer have the reverse mortgage, they have had a chance to make so much more money by having that reverse when they were living at home, that is going to ensure a longer period of time to be covered in one of the facilities that they have. And as Stephen was saying before, if one goes to a facility and one does not, you keep the reverse mortgage. The only time the reverse mortgage has to be paid back is like 12 months after the very last person leaves. So even if both people go to a nursing home, I said it. You shouldn't have let me say it, Stephen. If both of them have to end up going to an assisted living resort, it doesn't mean that they are there permanently. And if either one of them is expected back into the home itself within the year, you're fine. and that reverse mortgage just continues on and on and on for as long as the last person lives. So, but thank you for bringing that up, Stephen. That's and Cynthia.
Yes.
Yeah, well, I know that I see how the two of you work together right now and how it all meshes together. And that's why both of you need to be on that household board of directors now, not later. But so Cynthia, how long, let me just, some things off the top of my head. How long do you think people generally stay with somebody like Care Assist before moving on?
You know, it varies quite a bit, but I would say a typical, if somebody has an ongoing chronic healthcare condition that can be managed safely at home, and that can be, you know, mild cognitive impairment up to moderate cognitive impairment, so dementia, or, you know, sometimes some other medical conditions can be managed safely at home for 3 to 4 years. What usually happens after about 3 to 4 years, depending on the age of onset of their situation, is that they will deteriorate pretty rapidly. And as you alluded to in the very beginning, if they start requiring a lot of medical intervention, someone giving them injections, somebody giving them physically having to give them the medications, or sorting and, you know, that's
they can't be trusted
process.
to take everything they're supposed to take every day, right?
Well, correct. But what also happens is that those functions are really nursing functions and cannot be carried out by caregivers. So that when somebody needs too many of those things at one time, so they have multiple chronic conditions, then they would be suitable to make that move. But I think one of the other most important factors, which we didn't discuss initially, is what is somebody's family support structure? You know, do they have adult sons and daughters and people really close by that can really help and oversee the caregiving services? Or are they really isolated, they're widowed, they have no family? So that's another factor that would be a good reason to go, you know, to go into a community, is if there isn't really enough support around them to get them out of the house, to take them to the doctor, to take them to see friends and family, or, you know, extended friends and family, then I think they're better off in a place where they would have that support structure.
Now, what about a situation where somebody does not have family support structure and they're living alone? There'd have to be some kind of intervention, I would suspect. And I'm not sure where that always would come. I think that would have a lot to do with the person that needs the help. If they're cognizant enough to know that, then they can have, you know, they can call a company like yours. They can call their relatives and have their relatives do that. But I imagine there's some cases that slip between the cracks, right?
You know, it does happen that way. A lot of times it will be a concerned friend of the family, a concerned neighbor who may have lived next door to them for 60 years and realizes that they're really, you know, starting to deteriorate. It can also be they fall, they end up in the hospital. The hospital calls the next of kin, which might be a nephew in New York. The person in New York. Yeah. That is so common, that the nephew that lives in New York who hasn't even seen them in 5 years, but they go online and they do a Google search, and sometimes that's how they find us, because as I mentioned, we're a 5-star rated company. So they will call us and say, you know, I have this relative, they live alone, I need somebody to bring care. And so that's a lot of times how it starts.
Yeah, I mean, Craigslist is not the place to look for good caregiving, right?
Well, you know, people do what they feel comfortable with.
No, we talked about that a little earlier too. Not only from the legal point of view, which has to do with paying taxes, this, that, and whatever, but the moral point of view too, of knowing that you're working with someone who's trained to handle whatever problem that person who needs the care may have or may be moving into. Stephen, we were talking earlier about the fact that the people do not pay you directly. It's the care units, the resorts themselves, because it's probably less expensive for them to hire someone who knows what they're doing, like yourself, that can explain all of those things, like you did a little while ago. But I mean, can you imagine having to put your mother, your father, or parents, or whatever into? Now it's the time that they need to go into one of these resorts. The people themselves may not be wanting to. You as family members have a lot of emotional things to deal with. And on top of that, you don't want to be calling all these separate different places and set up appointments to go visit them when you can call someone like Stephen, who's got the information and can probably set you down or get you in the right direction, right? I mean, it's just too much at one time.
Yeah, and that's really my job, is to make sure that I do a full assessment of my client, their needs, their budget, and really make sure that I'm only contacting communities that can fulfill their needs at the budget level that they're talking about, and also in the location that they're looking for. We do a very thorough assessment to make sure that we understand all of that information, and that typically what ends up happening is I'll match about 15 or 20 different communities, but then what I do is I contact those communities to make sure that they're going to be a good fit based on some of the other factors, their social and activity needs, for instance. I had a client that just moved her mom into a community last Saturday, and one of the things that she really wanted to make sure of was that her mom could socialize with other residents at that particular community, and we were able to find one where the other residents were very high functioning, very social, and somewhere that she could make a friend. So it was really more than just about, who can do the best job at helping me take a shower, and more about really,
Right.
finding joy.
Like, is there a reason to take a shower or not? And that's important, I think. So it's really quality of life that you're looking for. And that's not the same for every person. And that's why you need to know all these places and get to know, the type of people that live there, the type of people that work there, the whole gambit, right?
Right. Yeah, exactly.
So, I mean, it seems so valuable to me. And then you probably get some people that are on the fence. Well, we're not sure whether we want to move into a place like this or not, or we want to put mama into a place like this or not. But at least, okay, if you don't know it, you're going to not know it forever unless you call someone like Stephen and get the information, because, as we said, applied knowledge is power. And if you don't know what your decisions really are, you don't have that power. And, I've heard a lot of other people talk about these things like yourself, Stephen, in advertisements on television, but nobody has ever shown they know as much about this subject as you've demonstrated here in the last 40 minutes or so.
I appreciate you saying that. That there are websites out there that will, say that they can find the best place for your parents. But honestly, they don't work locally in person with their clients. They are not going to tour with their clients, which is part of what I do. Part of my service is, I'll physically go out and tour these communities with my clients. And that includes during COVID. These communities have really learned how to protect their residents and make sure that we're touring safely. So these kind of internet services, they're not going to provide anywhere near that level of service that a local professional placement agent would. And there's some really good ones here locally.
Thank you for that. And excuse me, but Cynthia.
Yes, I'm here.
What would you? Oh, I know you're there. I just wish we had you on video also, but we'll get that taken care of. All right. I'm going to take that as my fault for not knowing Skype quite enough. So I'll help take care of that. We'll have it back soon. Oh, okay. Hello? Let's put Bob through.
Hey, good afternoon.
Oh, good afternoon, Bob. This is Jay. How are you today?
I'm fine, and you? How are you?
So far, so good. And I'm getting there, but I'm still moving pretty well. Okay.
Great. Well, your guests today and show are great. I have a question for both, and I missed the very first part of the show, so I hope I'm not asking something they've already answered. How do both of your guests in their world deal with COVID and its impact on people? Just curious.
So either one of you take or both of you take the question.
Well, I'll jump in. It's pretty easy with in-home care. We initially put together a very aggressive program to ensure that all caregivers had appropriate personal protective equipment. And that program continues to this day and probably will for a long time. So every household has the PPE delivered to their home. It's part of our care program. And thus far, we've been very fortunate that we have had extremely limited exposures within our ranks of care. And so we feel very fortunate about that. And we've managed it very effectively.
And I imagine, Cynthia, also you have, and of course, it may never have been part of your company before to have people move around, spend, Monday and Wednesday at this house and Thursday at a different home. You probably have as little of that as possible so people don't think they're being exposed to COVID or anything else, right?
You are 100% right on with that comment. We have limited the exposures of caregivers across the number of homes and clients that they were visiting, and really looking at scheduling efficiencies to ensure that people had as minimal exposures to multiple caregivers as possible, depending on the hours they have with us. So
I just want to make sure that Bob is not the same Big Bob that we talked about in the first half hour, who was the star of the film Arachnophobia. This is a different Bob.
Different Bob.
But on those same lines, Cynthia, how about, because Stephen handles those people where people might need help 24 hours. Do you have anybody or how often do you get clients that need help 24 hours, or you have a live-in, say, or if not a live-in, do you rotate the people in and out of a home that may need 24-hour care?
We do have those. We have them currently. We have had them, and right now the way we prefer to handle it is 2 12-hour shifts, so that each 12 hours the person being cared for has a fresh caregiver and fully attentive, because what we find in this industry is when you have somebody there living in, even though they're being paid for some sleep time, what happens is they're not getting uninterrupted sleep, so they're not really fresh. So we manage 24-hour cases with 12-hour shifts, and we do that very well.
Good, and that, to the extent that the clients feel they're well taken care of, they're not being exposed to anything they don't need to be exposed to, right?
No, everything is done, again, according to our protocols, strict protocols, and it works very well.
All right. And hopefully you guys in the business, unless maybe Cynthia at Care Assist, have you gotten COVID-19 vaccines yet?
I did. I was very fortunate.
Good for you.
I don't have the second one yet, but I'm really well into the first, and I feel very lucky I was able to get it.
Well, you guys are the ones that need it before anybody else, really. Because like I said before, when I went into the hospital, I felt I was really safe because everybody that was anywhere around me already had the vaccine. And I just had a test 3 days earlier that said I was clean. So what are we wearing our masks for? But, well, I wear a mask because I look so much better with it. But other than that, so hopefully I am hopeful that before the end of the year, things will be back to normal. And I don't want to get into that discussion right now because the downside of that is pretty awful. We lived through it last year. We did all right, didn't we? We lived through it.
We all got through it.
The COVID thing and the inability to go have lunch together or for us to go have some coffee now that the show is over. That's what we lived through. And, we lived through not being able to go visit relatives in person very often. We lived through learning Zoom. We didn't learn Skype, but I learned Zoom real well. And, some of that'll stay. I'll be using Zoom a lot more than I used to. But I sure miss going out to eat, going to the movies, sitting down with a big crowd. I miss that stuff a lot. So let's hope we can get back there. And I'm kind of confident we will before the end of the year, but I'm not putting it by summertime or anything like that. So I'm just hoping.
Me too.
Mark, they're with you.
I mean, I miss that social part of life so much. In those communities and resorts you talked about, Stephen, it's almost as if, they know where they are. They're wearing masks. They know who's been inoculated and who hasn't. And they probably have more social lives than us out here living, onesie and twosies. So there could have been probably a real upside to living in one of those communities this past year.
Yeah, there's no question. And, I think something that doesn't get talked about enough, and it's a huge concern, I think, for seniors, and that's isolation.
Yes.
Seniors have become more and more isolated with COVID, and it's something that's a real danger. And that is definitely a positive to moving to a senior living community, in that you are going to be surrounded by more people, that you're going to have access to other people your age. A lot of seniors that live at home, they may have lost a lot of their friends due to those friends possibly moving away or
passing away even.
Passing away, exactly. So, these communities can be a real positive from that standpoint, and being able to stimulate, that social part of you that is so important to.
Stephen, you've got me almost looking forward to it.
Yeah, all right.
Okay. But, we'll need to stay home and use Care Assist for a while first.
Yeah, to get used to it.
But, at the same time, I'll want to be taken out and shown all these different places. It's like taking, one those free vacations, and they have the, they give those 2-week getaways. Come have a free vacation for 3 or 4 days, it sounds like. So, I'm sure I'll be getting into that. But, your part, Steve, where you talked about all the different facilities that are available, Sean here, who I hope is going to get over his health problem right now, he'll be sending videos of this, and I'll send just a straight video without the news and without the other things, and then I'll cut it down into a little fancier ones and take my billboards and things like that out. But your dissertation on the different kinds of housing available is like perfect. So I'm going to cut that out by itself and send it out to as many people as I can, and we'll get it back to you to anything that you want to do with it. because, I mean, these are the kind of things and attitudes. I mean, you changed my attitude, okay, about a nursing home to a resort. And with that attitude comes the, oh no, I don't want to think about that. I don't want to look about. No, you have to think about everything here. You have to think about everything that you're going to plan for in the future, because us oldies, as my old friend Susan Geffen would say, if you're alive, you have a future. And if you have a future, plan for it. And we've got two of the best people ever right here. And so as we get closer, and like I said, I'm really, really happy both of you people stayed on as long as you did. I appreciate it. The listeners appreciate it. But go ahead and make sure that everybody has your contact information before we run out of time altogether. So either one of you, whoever would like to start, go ahead.
Go ahead, Cynthia.
Okay, I'll jump in. Again, I'm Cynthia Sender with Care Assist Services, and our phone number is 949-276-8413.
Go ahead and repeat that again.
Okay, and again, one more time, Cynthia Sender at Care Assist Services, and the number is 949-276-8413.
And that phone number is good, 24/7 or whenever?
Yes, it is. Somebody answers it 24 hours a day.
And that's you, right?
No,
always guaranteed to be
you? It's not
you?
always
They call?
me,
No?
but it can be me, but it will be forwarded to me.
Okay, all right. Well, that's fair enough. And anything on the internet that needs to be looked at for your company, do you think?
Well, they can jump on and look at our website, which is careassistservices.net. So just as it sounds, www.careassistservices.net.
Okay. Thank you so much. And
Thank
Stephen,
you.
Your information, and we'll put it on screen and things like that too as time goes. But go ahead, please.
Sure. Again, it's Steve Wanamaker, and the company is Oasis Senior Advisors, and our phone number is 949-535-1599, and you can also go to oasisssenioradvisors.com. And again, it's 949-535-1599.
Go ahead and repeat that number one more time before we're kicked off stage.
Gotcha. 949-535-1599.
Thank you both. I know we've got probably 30, 40 seconds left and then the hook comes out, but I want to thank you so much, Cynthia, you so much, Stephen. I mean, you were great people for so much information. And I hope we can get some people to call you. I know we will. And I appreciate both of you so much. And I appreciate
you,
all
Jay.
the
We
listeners
appreciate
also,
you and all that
our
you do for
engineer
seniors.
Sean for helping with all of this. And to everyone else out there, please stay really safe and give these people a call we've just been talking to. Have a great weekend and week. Thanks for listening.
Thank you. Bye-bye.
Empecé en pequeña rample de la Rampla de Barcelona. Me encontré una chiquita, pero la llevo ya a mi casa. Empecé en pequeña rample de la Rampla de Barcelona. Me encontré una chiquita y la llevo ya a mi casa. Yo te quiero a ti, ven, ven, ven.